Hello everyone. Today we are going to explore fasciitis, a common musculoskeletal condition affecting the connective tissue known as fascia. The most frequently encountered example in clinical practice is plantar fasciitis, but similar mechanisms can apply to other facial structures. Although traditionally considered an inflammatory condition, current evidence suggests that fasciitis often represents a degenerative process of fasciosis rather than acute inflammation. In this section, we will discuss pathophysiology, biomechanics, clinical presentation, and physiotherapy management. So, what is fascia? A fascia is a connective tissue network that surrounds and connects muscles, bones, nerves, blood vessels. And functional roles of fascia: force transmission, structural support, movement coordination. What is a key concept? Fascia plays a critical role in load distribution and energy transfer during movement. Pathophysiology of fasciitis. A traditional view. Fasciitis was previously thought to involve acute inflammation of fascia. Modern understanding. Current evidence suggests degenerative changes, micro-tearing, collagen disorganization. This is more accurately described as fasciosis. Contributing factors: repetitive overload, poor biomechanics, reduced tissue capacity, inadequate recovery. So, biomechanics of plantar fasciitis. So, windlass mechanism. The plantar fascia functions as a tension band. During toe extension, fascia tightens, arch elevates, foot becomes rigid. Dysfunction. In plantar fasciitis, excessive strain on fascia, reduced shock absorption, altered foot mechanics. Risk factors: overpronation, high arches, prolonged standing, running, or high impact activity. Clinical presentation symptoms: heel pain, especially medial calcaneal region, pain with the first steps in the morning, stiffness after rest, pain with prolonged standing. Key feature: first step pain is highly characteristic. Chronic case: persistent pain, reduced activity tolerance, altered gait. Clinical assessment: subjective examination, assess activity level, load exposure, symptom pattern. Observation: look for foot posture, arch alignment, gait pattern. Palpation: tenderness at medial calcaneal tubercle. Range of motion: assess ankle dorsiflexion, calf flexibility. Functional testing includes walking, single leg stance, loading tolerance. Differential diagnosis: important to differentiate from fat pad syndrome, nerve entrapment, stress fractures. Key differentiation: plantar fasciitis worse with the first steps, improves slightly with movement. Clinical reasoning. So, step 1: identify load vs capacity. Excessive load, reduced tissue capacity. Step 2: identify contributing factors. For biomechanics, food wear, activity patterns. Determine stage: acute, subacute, chronic. Physiotherapy management. Education: patients should understand condition is load related, gradual recovery process, importance of consistency. Load management: reduce aggravating activities while maintaining safe movement. Exercise therapy, core treatment. Stretching focuses on plantar fascia, calf muscles. Strengthening, important for intrinsic foot muscles, calf complex. Progressive loading, gradually increase low tolerance tissue capacity. Manual therapy may include soft tissue techniques, joint mobilization, used as an adjunct to exercise. Taping and orthotics helps to support arch, reduced load on fascia. Footwear advice: recommend supportive shoes, shock absorbing soles. Advanced consideration: chronic fasciitis may involve central sensitization, altered pain perception. Multidimensional approach: management should include biomechanical correction, strengthening, load progression. Clinical case example: consider a patient with heel pain on first steps, prolonged standing job, tight calf muscles. Clinical reasoning: plantar fasciitis due to overload and reduced flexibility. Management: stretching, strengthening, load modification, footwear advice. Key take home points: fasciitis is often degenerative rather than inflammatory. Load management is critical. Exercise is the primary treatment. Biomechanics plays a key role. So, fasciitis highlight the importance of understanding tissue loading and adaptation. As physiotherapists, our role is to restore balance between load and capacity to promote recovery and long-term function. Thank you for joining this advanced discussion. I will see you in next video.